Hello, everyone. Welcome back to Real Talk Savannah. We have my girlfriend Dallas, the owner of Tox Medspa, today. I'll let her tell a little bit about the spa, like everything that they do here. But she's also my nurse here, and I want to do a consult with her because I want to feature how she does a consult because that's one of the most impressive things about her to me and her services here. But tell everyone about Tox.
Tox was started last year. We opened in May of last year. Prior to that, I was working for another plastic surgeon in Savannah, and I grew my practice under them. I gained all of my clients through them. He trained me, and I learned a lot while I was there. And then it just came a point in time where it was time for me to go off my own. So we opened Tox Medspa, and we have grown so much in a year. I feel like every single week there's more things on the to-do list to just keep climbing and keep growing, but that's the whole point.
I know we need to have you back on just for business advice because I feel like she does such a good job.
Gosh.
But I messaged her recently. So I am going to get a little vulnerable in here because, I'm 42. This has been a very stressful year for me. So whenever, I've dealt with some, like my hair is thinning slightly and I know it's stress. I'm back on my collagen. And we both chopped our hair off this year.
We did. I did that. Yep.
Just to make our lives easier. I think that we both had the same reason.
It was so freeing.
Mm-hmm. It really was. I cut off some old energy for sure. But I messaged her one day just because I was having, a week where I just felt like crap. For a while there, like I love everyone that has a business. So for a while there, I was going to several different people to get my injections and Botox and I love all of them. But when I hosted Dallas at Beat 10 at the new shop, I really was so impressed with how much time she spent with each client that came in. And to the point where we started at around 5:36 and we didn't get out of there till after 9:00 at night.
It's because I talk a lot.
Yeah, but it's good. It's really good because this is a medical procedure. So it really is good to have that full consult with each client that sits down with you. So, I felt comfortable texting her, the issues I was having. I've had some filler in my lips and it's migrated. I haven't had it in quite some time. So I want to make sure that I get the natural results.
Yeah.
I want to look natural. I don't want to look like I'm filled up. And my Botox, she was able to help me put it in the right.
Strategically.
I have to keep some lines on my forehead, but I'm very happy with my brow now. So we went through a long consult. And today I think that I wanted to do a consult with her just to talk about my issues with what I'm having on my face now or insecurities. And I just wanted everybody to hear how good the consult is because she's never selling what she has to offer. She'll tell me no, which I think is really important. So that's what I wanted to feature you today because I'm really impressed with that. I think we're all going very fast in life and it's just something to be said when someone takes the time to listen and care.
Yeah.
And
it's a very scary thing. It's a very scary thing to sit in the chair.
Yeah.
Up against someone who is looking at faces all day long. It is very scary to be that vulnerable.
Mm-hmm.
But I am so empathetic. I have to make sure that the client is so comfortable before we do anything.
Right.
I want to know you. I want to know your personality. I want to know where you're at, like in life, what your goals are, like in here, outside.
Mm-hmm.
I want to know about you as the person. Yeah. And then we can talk about other stuff too.
Yes. Which is why I wanted to have her on today.
Yeah.
So she supports us, us as clients. I really wanted to highlight, her strengths and why I'm so impressed by her. So for me, my issues lately, I'm 42. Again, a stressful year. Stress wears on your body heavily. I've noticed lots of things. I like natural stuff. I'm a castor oil queen. It's probably why I'm single. I'm covered in castor oil every night. Very shiny and greasy.
Like a glazed donut.
I like all the natural things I do. I'm a natural girl. I don't take medicine when I'm sick. I'm very natural, but there are some things that castor oil just can't fix.
Yeah.
So one thing I'm super insecure about, I think everyone is like the tech neck. I also it runs in my family.
Yeah.
I call it the gurgle bop the turkey neck. Like I know what's coming. You know, we can all look at our mothers, and I look a lot like my mom, so I can tell, you know, some issues I'm going to have in the future. So I have been doing exercises for that, and it has helped. And I have been doing gua sha and lymphatic massages, and those it does help. Yeah. But it does come back very quickly. I also love red wine. So I know inflammation is huge with red wine. So a lot of times it's just straight inflammation. Yeah. So I do want to focus, you know, on my neck these days. And then the deep smile line. My face falls on, if for those of you who are just listening, my lower cheek and the chin area, you know, all of this starts to fall. And even though people think I look young, I can tell, younger than I am, I can tell.
You don't feel as tight as you used to.
Yes. Yeah. I'm really happy with the results of my Botox. My lines are back on my forehead, but not as deep as they were prior. So you did the perfect amount of Botox. Yeah. And I'm able to do the RF treatment with Ginger, the Eterna at the shop, to smooth out the one that you didn't want to mess with. Right. So it's a good combo for someone like me whose brow can drop from too much Botox. The RF at the shop is a very good treatment to kind of do. And it's very accessible to me because it's in the shop. Exactly. But it does smooth that out. So, you know, today I want to touch up the Botox and then just come up with a plan. Yeah, for sure. And then I'm going into busy season. And so I want to come up with a plan and a budget to get everything. Yes. I do all my stuff in spring. Yes. Because that's when I make the moolah.
That's okay. That's okay. You mentioned the neck. So we'll start with that. We'll start with that. Okay. So with the neck, there's a couple different things that people are bothered by with the neck. Is it creasing in the skin? Is it laxity? Is it fat? Where are you at?
I think right under the there's less there's way less definition with my jawline. Okay. And I have done filler there in the past, and I felt like it migrated. And the first time I did it, it didn't stick. She did it here. Okay. And then I went and got my hair done after in the shampoo bowl. So I don't know if it was that I laid in a shampoo bowl after, but it just didn't stay as sharp as it. And I almost felt like I got heavier underneath. So I don't know if it moved or that's just in my brain.
Probably not. When you do jawline filler to help tighten a neck, you have to use a lot of filler. Yeah. Okay, let me tell you this. 5 syringes, that's a ketchup packet.
Oh, okay.
To put it into
that's a really good way to put it.
You know, to put it into perspective of how little. Right. Like you're like, someone's coming at me with 5 syringes. I'm going to look over Phil. No, you're not. Mm-hmm. No, you're not. That's a ketchup packet. And then imagine spreading that all over the whole, you know, face, everything, or jawline. Yeah. So I am very, very pro surgery. I send a lot of patients out for surgery because I worked in a plastic surgeon's office with a double board certified plastic surgeon for over a decade. And I didn't want it. I didn't want to sell you the filler that was going to give you an result. Okay. I didn't want to tell the patient they need 6 syringes across their entire jawline, maybe 1 or 2 on each side of their gonial angle, maybe 1 or 2 in the prejowl sulcus, maybe 1 or 2 in the chin shadows, whatever. I mean, you're cha-ching, cha-ching, cha-ching. When they could just go over there, get a minor liposuction and the fat's gone. Yeah. I mean, or do it's mildly invasive skin tightening procedure he had there, but there are surgical options that are just going to be, in the big scheme of things, like
way better, more results, and probably more lasting.
I'm just super pro surgery.
I love that. So I love being told that instead of, because I've tried it twice. It is pricey when you get the amount that you need. And even so, I was like, I don't think that's for me. How does the Botox in the neck help?
Okay. All right. Good question. Botox in the neck, what we're targeting, and you could probably see some of mine when I do this, but you're targeting the platysma bands. So they're the vertical bands that go up and down. So across the entire neck is a muscle called the platysma, and it looks like a big sheet across the neck. And I'm going to strain. This is going to look funny, but all of y'all will know what this is. When you strain and you get these lines here. So what we do is we Botox the platysma vertical bands, as well as right underneath the jawline. It could be under or over. It's preference, but this is right where the platysma attaches. What it's doing right here, why we do it along here horizontally, is because the platysma pulls the face down. Gotcha. So when we relax that part of the platysma muscle right here, as well as going straight into the vertical bands. The vertical bands get flatter.
Okay.
You might not be able to fully eliminate them.
Is it more preventative because it's stopping the pull?
It's stopping the pull. It lifts the neck.
Got it.
So if you're not having that chronic pull down on the face from the platysma muscle, then your jowls will be a little better.
Okay. Gotcha.
It's not going to lift your face like a facelift.
Right.
But it's going to stop the pulling down.
Pull. Does that affect the lower face muscles at all?
Yeah. There is one that can affect your smile. It's called the DAO muscle right here. It makes you look sad. Okay. So when we inject that, we are telling that muscle to not pull the corners of the mouth down because gravity is not helping this section either. Right. It contracts downward, gravity pulls downward.
Okay.
So when we inject it right here and here, it's going to, I like to tell people it's going to also do the same thing like the platysma. It's going to keep us from pulling down.
Right.
Is it going to go up? Yes, but you're not going to look like Stifler's mom.
Yeah.
It's not going to be like, hi. Okay.
Good reference. Good
so
reference.
why it affects the smile in some patients is because some patients, when they smile, you see a lot of their lower teeth when they smile, like their bottom lip goes really far down. You see a lot of their teeth. So if we are trying to raise the corners of the mouth, by default, the lower lip is going to kind of raise up a little bit. You might see less of their teeth.
That makes perfect sense.
I'd say about maybe 1% of people don't like that injection. 99% love it because they don't have that like resting bitch face. You know what I'm saying? Like, also when we make that face, and millennials are kind of guilty of this when we go to the club and we're like, we make that face. Okay. You get over time, you get this little like creases here. So it helps with those too. Okay. So just getting the pressure off the skin in that area. But that would be why it changes someone's smile.
Okay. Yeah. So I'm asking her all these questions because I'm trying to come up with a plan and I always get the best answers from her because she takes the time to answer all of that. Let's just go up. So the harsh smile lines. Everyone, all of my friends that are around my age, this is really where we start to notice the deep line.
What's interesting about you is you have really good zygomal width. So your cheekbones, you have beautiful cheekbones, you have beautiful cheeks.
That's what's making me look younger.
Yeah, you do.
That's what's helping. Yeah.
I don't want to, like, a lot of injectors, their first instinct is like, oh, well, you have this because you've lost it up here. That, is true a lot of times. But in your case, I'm not like drawn to your cheeks. We would look there first, okay? Because usually as people age, they lose bone, fat, muscle atrophy, whatever. When you lose it from up here, it kind of falls and then you create a shadow here. But you don't really have that much of an issue. You don't have a lot of deficiency in the cheek area. And I would be hesitant to want to just fill your cheeks because I don't want you to look like you have softballs on your face.
Yeah.
I also heard that you do like the natural path, right? So I think what would be really good for you is to maybe do the PRP gel.
Okay.
Have you heard of this before?
No.
Okay. So we're going to draw your blood. We're going to spin it. We're going to separate the red blood cells from the plasma.
Okay.
The plasma looks like liquid gold, and it's got what's called PRP. It's platelet-rich plasma. It has platelets in it.
Okay.
Why do we want the platelets? Because they have growth factors. Anytime you get an injury, like a cut on your body, your blood is going to go there, bleed, but platelets are going to stop the bleeding, right? They're going to start sending out little signals to help you heal. Okay. So you heal because the platelets have growth factors and told your body to heal.
I have seen videos of this. I just didn't know what it was called.
Yep.
I get sucked into the rabbit hole of this online all the time.
Yes. So now that you have healing tissue, you have collagen production. That is what healed tissue is.
Is that something you do regularly or...
That's a good question. That's a good question. So once we get someone to optimal, so that could be different for everybody, but most people would do 1 to 2 sessions. If you're pretty hollow, like your skin is just very damaged, sun damaged, whatever, we might do 3. After that, you could just do like 1 a year for maintenance.
Okay.
But we would take that PRP, that liquid gold, we would turn it into a gel because traditionally back in the day, we were injecting the liquid version of this and we still do, but it's cooler now because we've learned how to turn it into a gel, which when we do that, it gives you volume. So whereas before we were injecting the liquid and the liquid's going into, like, example, the lower lid hollows or right in here in the nasolabial fold, and it's signaling for collagen production. Fabulous. But now that it's a gel,
is it plumping?
It's plumping. You're getting a little bit of a plumping effect, but it's your body.
And see how she explains things? I get it. And
well, don't ask me the scientific names of things.
No, it's, I mean, you're putting it in layman's terms, so I'm understanding everything.
Yeah. That would be really good for you.
Yeah. Yeah. So I like that plan because I like that I'm not putting.
You won't have an allergy.
And I have done filler here before.
Yeah.
And I did not really.
Well,
and I didn't feel like myself. I was ready for it to dissolve. So I don't think that was a good choice for me at all. I think this is a better plan.
Yeah.
And then I think what we're doing already with my eyelids, I felt like I swear you guys, I was like, I'm going to have a upper eyelid surgery. They're heavy.
Well, we all
heavy.
will
and
at some
all
point.
We did was change where we put the Botox, and I had to deal with the forehead wrinkle, which I'm now using.
Foreheads are the hardest thing to get right. I don't care what level.
I had wrinkles in my forehead when I was 5. I mean, I just had a small wrinkled forehead.
Yeah.
Like my forehead is small.
I don't do the whole glass forehead thing. Because people are all of a sudden discovering that, you need some wrinkles in your forehead in order to keep your eyebrows out of your eyelids. Whereas before, I don't know, maybe 5 years ago, it's like, oh, she still has wrinkles here. Like, oh, God forbid. And it's like, well, yeah, but we kind of need that muscle to hold our brows up.
And in my case, my forehead's really little. So by filling my forehead too much, my brow was dropping.
Botox. Yeah.
I noticed when I put my makeup on, I don't have 11s for whatever reason. I'm never made that face. I was trying to get the flattest forehead ever until we had that conversation. And now I'd rather deal with I have one really hard wrinkle, which is probably my most expressive, my left side. And, but I'm so much happier with my brows and my makeup and everything.
There are ways to do it. I have injected in that area before, which the area that people hate is the one right above the eyebrow. They're like, oh, I hate that wrinkle. And I'm but let's talk about this. So I'm like, let's talk about this. So have I injected that one before? I have, but you have to inject it very low dose, very superficially, meaning right under the skin, not deep down in the muscle, because then you're just asking for it to drop. Even so, even if you do it really superficial right under the skin, very low dose, meaning it's not going to last that long. It's going to last you a couple weeks, and then you could still risk dropping someone's eyebrow. So why?
I just would rather deal with it. And like I said, I've been doing the RF. I have been doing lymphatic stuff. It's helping. So that's good. I liked our plan with that. I've been extremely happy. And I'm feeling better with my makeup. I was not feeling good with my eye makeup at all. So I think a good plan is obviously, what was the name of it? The plasma.
Yeah. We'll do some PRP gel on you. I think that you would really like that because it's softer than traditional filler.
Yeah, I love it.
It's very forgiving. It's very airbrushy. If someone needs cheeks or someone needs a chin or whatever, I'm not going to grab PRP gel. It's not going to give me the shape.
Gotcha.
But we're just asking your body, hey, go in here and start to thicken up the skin a little bit.
Okay.
That's what we're asking it to do.
And then lastly, lips. So I haven't had it done in a while. So I think I'll show you it. But I have and I have a habit now of biting it. So I'm making it worse.
Yeah.
I've bit it probably 20 times since we've been sitting here talking. Yeah. So the plan would be to dissolve that.
Yes. I'm going to numb you up really well. I do use the dental block. I know that is so controversial.
I'm so weird. I can get tattoos, but there are certain things I can't get. My hoo-ha wax, and I can't get the dissolving. It's something about the itching. I don't know what it is. But it's like a itching, burning, which most people are didn't hurt me at all. But we all are sensitive.
And you didn't have a reaction to it, you didn't.
No reaction.
Yeah. So we're going to just make sure that we numb you up really, really well. And we're going to just dissolve it, and you come back a couple weeks later, and then we'll reassess.
And so, I like my lips. I love the shape.
I'm not really interested in
enhance them a little, just nothing crazy.
Yeah, I actually I like your lips too. I'm not like, oh, Michelle, I have got to do something about your lips.
Right.
These are horrible. No, I just think honestly, I'm not going to try to mess with. I know this is really controversial too, because a lot of injectors are like, oh, dissolve everything and start over. Maybe sometimes I do, maybe sometimes I don't. And you have a problem with
just the inner top lip.
So I'm just going to target that.
Right.
I think your upper lip looks beautiful. I don't really need to do anything with the bottom lip. So for you, it's like a case by case basis. Don't feel like dissolving everything. I'm going to just kind of target what we need to dissolve.
And the last thing I want to talk about too is a lot of people are on a budget. I'm just coming into busy season with my business. I had some crazy stuff happen in the last 6 months. So I'm going to come up with a plan. What I love about Dallas is we also talk about price, and we can set up a plan. So I can set up the appointments for when I need it.
It's full transparency.
Yes. And set up a plan, make the appointments. I'm prepared financially. Me and my friends talk about this stuff all the time. We'll walk into an establishment, get stuff done, and then the bills out. You don't know it before it happens.
You don't know till you walk up to the front, and that bothers me. I hate to even
talk about money, but I think this is
that's why
people don't understand units and like pricing. Correct. So I think it's good to have, here's the price for everything. Let's set up a timeline, and then I can breathe instead of throwing it on a credit card and hoping I paid off next month. Do you know what I mean? Like that's where, and I know a lot of my listeners, my clients, my friends, this is, I think coming up with a plan. Jessica Taylor's my primary care physician. Yeah. And she comes up with a plan for me all the time. I adore her for that.
Yep.
For my labs and for everything. Yeah. So I think we're all living on a budget. Life has been hard for us. So I think this was a really good topic to bring up to end on. Like, it's okay to talk about money and a budget and a future plan.
Oh,
and
100%.
Somebody willing to do that.
100%. And we lay out options. So it's like, you're not going to sit in front of my chair and be like, okay, so you're sitting here today and you want some Botox and fillers and that'll be $5,000.
Right.
No, let's break down what's most important to you, where you're at in life. Let's look at this whole thing. So, because what's going to make sense for you is not going to make sense for the next person, and so on and so forth. You have to be comfortable. But when we lay out these options for you, you don't have to even listen to any of those. That's what I'm trying to look for, is the biggest bang for your buck. And sometimes, like, if it's an extensive plan and, someone does need multiple syringes, or it's like, we need these skin tightening procedures or whatever, and it's like a bigger plan, and I'm like, oh my God, I really don't want to tell her the price of this. I don't, because I don't like that. If they ask me, what is it going to take? I send them for surgery. I send them for surgery, because at some point, I'm not taking your $12,000. That's half of what, or maybe not, it's close to half of what a facelift. Like, that's why I need to talk to you first. I need to get to know you. I need to see where you're at. But we can go through, if you're like, surgery's just off the table, then I can say, okay, well then this is what you're looking like. But I heard this from another injector. Shout out to Carly in outside of Orlando. She actually taught me to say this. I was like, this is such a good way to say it. There are many ways to get to where you want to be. We can walk, we can run, or we can sprint.
Oh, I love that.
So, and she broke it down into like packages. If you want to sprint, you're going to be spending this today. If you want to walk, we can do this over several appointments, and you just be spending this today. And I was like, you know what? That is so cool. So I started using that in my practice. Perfect. Yeah.
Well, that is how I wanted to end. That I just wanted to do a consult. I love that I was vulnerable and told you everything that's bothering me. We have a clear plan. Thank you so much for coming on. I just adore you. I think, you're awesome. You're a great supporter of Beat10. She came to the grand opening. She was part of, two of my first pop-ups. So I appreciate you so
much. I love the product.
Yeah. Oh yeah. And she does Beat10 here. Oh my gosh, let's not forget that. So if you want to book a Beat10, she is on the south side, and it's easier than parking downtown. So the spring is coming up, proms, weddings. So Dallas,
St. Patrick's Day.
Dallas and her team are doing spray dance here. So.
Yeah. Keep us in mind. We've got a Facebook. We have a TikTok. We have an Instagram. We have a
Medspa.
Tox Medspa Savannah is the handle, at Tox Medspa Savannah. There is another company in Savannah that has the name Tox in it. I think they're the Tox.
It's lymphatic massage. So
lymphatic massage.
But you've got a good relationship with them. So you guys, when people get it mixed up, they're sending. You guys send each other. So it's Tox Medspa.
Tox Medspa.
Easy to get to.
Yep.
If you're a downtown girl, we do pop-ups. But if you can't make it to the pop-up, we did the drive today. Missy and I was like, it's gonna be 30 minutes. And she's like, it's 17. And she was totally right. So
if you have like any questions, we've got on toxsav.com. So it's toxsav.com. I have pricing guides on there. So that helps too. If you're like, oh, I really just want my crow's feet, you can go on there and look, and I give you like an about of what that would cost.
It's very clear pricing.
Yeah.
I love that.
Yeah.
All right. Well, look her up. Come visit her. If you have any questions, you can obviously message us at Real Talk Savannah and we'll connect you, but we'll also have all of her info in the show notes. So
perfect.
Thank you.
Yeah, of course. Thank you.